NHS bosses have failed to declare nearly £4 million of luxurious payouts, a damning investigation concludes. Regional health trusts accepted £5,027,818 from firms, including some of the biggest drug companies, between 2015 and 2017. However, only £1,283,767 was listed, meaning clinical commissioning groups, CCGs, have ignored strict requirements from NHS England. VIP tickets for a Manchester United FC match and a Baines concert were among the thousands of gifts that were publicly declared. Critics are concerned the vast amount of funding CCGs get from pharmaceutical firms could result in prescribing that harms. The investigation, published in the British Medical Journal, was based on Freedom of Information requests from all 207 CCGs in England. Funding declaration data from each CCG was then compared to the sums that were jotted up in the FOI figures. NHS England requires all CCGs to declare all conflicts of interest and to maintain and publish registers of potential conflicts and procurement decisions. Researchers from the University of Bath and Lund University, Sweden, analyzed the data to make the conclusion. Their investigation revealed only two-thirds of the 4,600 payments accepted from private firms and charities were listed by the CCGs. This amounts to three-quarters of the total sum having been hidden from patients and public over the space of 2 years. Warwickshire North CCG was given 89 payments with a value of £24,150 between 2015 and 2017 to sponsor educational events. However, these weren't listed in the CCG's current online register. 9 CCGs accounted for nearly half of the number of payments received, including Warwickshire North. The others were Sheffield, Waltham Forest, Swale, Coventry, and Rugby, North East Essex, South Tyneside, Coastal West Sussex and South Kent Coast. Professor Paul Glassiou, at the Centre for Research and Evidence-Based Practice at Bond University in Australia, was concerned over the research. Doctors are often unaware of the effect of drug companies' activities on their own behavior, he said. He added, pharmaceutical company dominance of the funding of continuing medical education can result in prescribing that harms. Piotr Zyransky, of Bath University, who helped with the investigation, thinks it is inappropriate for commissioning bodies to accept funding from the private sector. He said, it seems rather peculiar that CCGs are permitted to accept any payments or benefits in kind from private sector companies. CCGs often outsource the logistics of arranging event sponsorship to hospital trusts and private companies. The local health boards, which decide what scarce funds should be spent on in certain regions, have also sought funding from drug firms to support internal meetings. More than two-thirds, 73%, of the funding from pharmaceutical firms was for sponsorship of education and training events. Some 19% of the total funding from Big Pharma was for projects. Southwark CCG received £24,000 in funding for a project, but it failed to declare the five-figure sum in its online registers. The money was provided to the board from Bayer, which makes aspirin, Pfizer, famous for Viagra, and Boehringer Ingelheim. The Association of the British Pharmaceutical Industry says drug companies have an important role in supporting healthcare organisations. A spokesperson added it shares an ambition with the NHS for greater transparency and disclosure of financial information. And several CCGs say sponsorship arrangements with drug companies allow them to host more educational events than they otherwise could. However, many CCGs already accept no payments from charities or private companies. For example, NHS Hastings and Roeder CCG told the BMJ this helps to avoid any potential or real situations of undue bias or influence.